Pride Month is officially here. June is dedicated to celebrating the LGBTQ plus community, culture, and events. Pride Month started in June of 1970 as Pride Week. It marked 1 year since the violent police raid on the Stonewall Inn, a gay bar in New York City. This year marks 50 years of celebrating Pride here in Denver. All of the fun starts the weekend of June 21st. One of the biggest events, of course, is the parade on Sunday, June 23rd. That will end with a big party at Civic Center Park. We will have special Pride Month coverage here on 9 News at noon all month long. We have segments dedicated to celebrating and informing the LGBTQ plus community and their allies. And we kick things off this noon by raising awareness about eating disorders, specifically in the LGBTQ plus community. The National Institute of Health says gay men report greater body image issues compared to heterosexual men. Lesbians report lower body issues compared to bisexual and heterosexual women, but greater self-hate. Here to help us break it all down today, we welcome Serena Nangia from Project Heal. Thank you so much for being here, Serena.
Thanks for having me.
Of course. So you've been with Project Heal for a couple years now. For anyone not familiar, y'all are located in the Springs. Share a little bit about what you all do.
Yeah, so Project Heal is a national eating disorder nonprofit, and we focus on helping people access care for eating disorders based on equitable access. So helping people who can't afford it, as well as people facing systemic barriers.
That's wonderful. So talk a little bit, we talked a little bit in the setup about how eating disorders are impacting the LGBTQ plus community, but kind of varying levels here with men and women. Can you expand on that for us?
Yeah, our communities really affect disproportionately high amounts of eating disorders. So they are experiencing eating disorders for all types of people at any size, any gender, any race. What we do know is that trans and gender nonconforming folks experience eating disorders at higher rates, even more than just straight cisgender queer folks. So they experience they're 4 times more likely to experience eating disorders.
Yeah, I mean, that's a pretty big, disparity there, right,
Yes.
Serena? So what are some of the ways that you're helping people kind of reduce that stigma, open up access to, getting some treatment and raising awareness to that?
Yeah, so we have a free clinical assessment program which helps people access a diagnosis if they think they might have an eating disorder or they don't know. And we also have general information on our website at theprojectheal.org. We're also working on, we just launched a study called the Barriers to Eating Disorder Treatment Access Study.
Yeah, talk to me a little bit more about that study because it's really interesting.
Yeah, so we found 2 main things. One is that 70% of participants reported that weight stigma was a huge barrier to accessing eating disorder treatment. And the other was that 81% of people experience financial barriers to accessing eating disorder treatment. So what that means is that someone couldn't afford treatment based on the fact that they either had to empty their bank accounts, that insurance didn't cover the appropriate level of care, or they just couldn't afford it outright.
Yeah, absolutely. It can be really, really expensive. We also want to touch on how stereotypes are affecting people getting treatment or even seeking treatment.
Yeah, so specifically in the queer community, we have to recognize that everyone is able to get an eating disorder. Like I said, eating disorders affect everyone from race to gender to size. So when we look at someone, we shouldn't think about what we think someone has as an eating disorder. We should just pay attention to behaviors. Is someone experiencing binging sessions? Are they not eating? And then specifically when accessing treatment within queer communities, we have to recognize that sometimes treatment centers aren't necessarily the safest place for queer people. And so when accessing treatment, paying attention to researching where those places are and where the best places to go for treatment are. And Project Heal can help with that as well.
And that's really cool. So if someone comes into Project Heal and they don't really know where to begin, or maybe they're watching and they're thinking about stopping in, what would you share with them?
Yeah, so I think the first thing is that you're not alone and that anyone can have an eating disorder. So there's no such thing as sick enough. Any level of distress with body image and eating is valid, and that if you think you might have a struggle, you can just come to our website, and it's completely free, there's no requirement to follow through on any treatment plan. You just come and find out if you have an eating disorder or not.
Wonderful. And Serena, really quickly tell us how people can specifically, you mentioned the website, but specifically come and get in touch with you all if they're interested.
Yeah, so again, the website is theprojectheal.org. We're also on social media at Project Heal. And just head to our Apply for Support page and you can find all the different programs.
Amazing. Serena, thank you so much for joining us. We so appreciate it.
Thank you so much for having me.
Of